and searching for exceptional talent, contact Monarch Technical Services at 847-342-1221 or online at monarchtechnical.com. And if you're interested in starting a career in manufacturing or have experience, visit monarchtechnical.com to upload your resume.
Summertime is the perfect time to get outside and get your morning going. So grab a Nature Valley granola bar, get outdoors, and experience the energizing power of nature this morning.
7:38 Team Hochberg Traffic Center time and Jim.
I-55 southbound traffic is stop and go from US 6 to Bluff Road due to construction. Farther north on the Stevenson Expressway, inbound delays start around Cass. Your travel time to get from the Veterans Memorial Tollway to DuSable Lakeshore Drive is 36 minutes. Outbound, it's 22. Inbound Kennedy, 31 minutes. O'Hare to downtown. Outbound 26. Inbound Eisenhower. The delays start at North Avenue. 43 minutes, 390 to downtown. Outbound 29. On Bryan, it's 21 minutes, 95th to downtown. Northbound DuSable Lakeshore Drive is tight. 18th Drive to Monroe. We're seeing delay on the Adams Tollway. Eastbound I-90. Traffic is slow from Lee Street to the Devon Toll Plaza. It's about a 5-minute delay. I'm Chip Talamonte on AM 560 The Answer.
Chicago's Morning Answer continues next. AM 560 Weather Center forecast. Clouds and sun, hot and humid with a strong thunderstorm. Possible late today, high 93. Storms could break overnight as well, too. Warm and humid, low 72. 75 at O'Hare. Next news at 8. Chicago's Morning Answer with Dan and Amy continues next on AM 560 The Answer.
From the Matrix Home Solutions studios, this is Chicago's Morning Answer on AM 560 The Answer.
Listen to AM 560 The Answer online at 560theanswer.com, on the AM 560 mobile app, on your Alexa-powered smart speaker, and on TuneIn, iHeart, and on Odyssey.
Mike Manokin runs the Democratic House floor for 30-plus years running. He's promising this and he's stealing that. Where can you get that kind of money? He's using your house like his own piggy bank. You ought to know by now. You can pay off your house here in Illinois, but you can never keep up with the taxes. Oh, how it's always been the plan to have a taxpayer pay, no doubt. Not a matter of if anymore, but when you're moving out.
Yeah, that's theme music means it's time for our weekly confab with Ted Dabrowski at Wirepoints.org. Before we get to that, if you're not moving out, maybe you should be moving to Orland Park. We played some clips yesterday of this presentation that the mayor there, Keith Pekow, made at the last Village Board meeting, just going through the data, CDC, IDPH data, the local data here in Orland Park, in Chicago Metro, against the backdrop of the mask mandate that Governor Jelly Belly imposed on K-12 school systems and
private,
and
parochial, everywhere.
Mm-hmm. And here was just the data on cases, daily deaths.
So this is the cases since the beginning of April of last year. You'll see that you see a spike on the left-hand side. That was our first wave. Now, it's so low because we had no testing back then, if you recall. So the cases are, you know, as anyone would probably tell you, the cases were higher than the one at the end of the year when we had a lot of testing because we had no testing. So you had a spike, you had another spike. Then we actually had a third surge in April, May. You see that little hump? And now we are actually in the middle of a fourth surge. You see how much lower that surge is? So this mimics a lot of things in nature and in science, the dampening of vibration in a bridge, flutter in an airplane wing. You throw a ball up and bounce, you'll see the same kind of graph. Anyone who's had some basic science have seen these kinds of graphs before, and that's exactly what's happening here. This is a virus running its cycles. Okay, so it's a fourth surge. It's less than the others, and like I said, we're well into it. It is also much less impactful. For example, what we were told yesterday in Chicago, the deaths per day on the first surge was 50 a day, then it was 25 a day in the second surge. Third surge, it was 7 a day, and now it's 1 a day.
1 a day. Lock it all down, shut it down, mask them up.
Local hospitals being overwhelmed?
For example, here locally, we have two Silver Cross and Payless Hospital. There's one person in the ICU bed in each with COVID. That's it. And even yesterday in our mayor's caucus briefing, the hospitals are not at risk. No one's saying that they are at risk. So the question is, if this was all done, these mitigation factors were all to keep the hospitals from being at risk, and the hospitals aren't at risk, why are we taking more mitigation measures?
And we had Francis Collins on over the weekend with Clinton Foundation Donor Zero on the question of all this children are getting it more, children are being hospitalized at a greater rate. Is that right? Certainly not relative to other age cohorts, like 12 times less than those over 80, but just in absolute terms as compared to COVID 1.0. Listen to Francis Collins, the director of NIH, on with Clinton Foundation Donor Zero. First, fearmonger, and then admit he has no data to support his fearmongering. It was remarkable.
Okay,
and, of course, it went unnoticed by Stephanopoulos.
Largest number of children so far in the whole pandemic right now are in the hospital. 1,450 kids in the hospital from COVID-19. And of course, since they're under 12, many of them, they couldn't be vaccinated. But the rest of us who are over 12 could have done a better job.
Let's dig into that on children a little bit more. As you point out, we are seeing more children hospitalized, some children even dying from this. Is the Delta variant more serious for children?
You know, we don't have rigorous data to show for sure that they are.
We don't have data to show. Mm-hmm.
We have our feelings.
Where was the pushback on that?
We have our feelings.
Oh,
And that's all we need. We have our fear-mongering, and that's all half of America needs to go along with it. Ted Dabrowski, president of Wirepoints.org. Ted, thanks for joining us. Appreciate it.
Hey, good morning, Dan. Good morning, Amy.
Well, I think it was
California.
You're there helping with the Newsom recall, or you're just
exactly. That's you can see there's a lot of energy here for that.
Sure, your cover
No,
story
is
at
there?
least. Well, I don't. I think it's a 50-50 proposition right now. Him being recalled. Are you passing out flyers for Larry Elder?
Yeah, I went to Monterey and saw the guy standing in the middle of the street saying, recall Newsom. They're honking the horns for Elder. It's pretty impressive out here.
Cool.
Well, that would be just. I mean, that would be seismic.
Yeah.
If he's recalled and Larry Elder is the governor of California, that will be felt in space. That is how big that will be. Holy cow!
Well, yeah, at least they have a chance. At least they have a chance for that. But yeah. Get back to Illinois.
So back to Illinois. So some of what you heard from the mayor of Orland Park and some of the usual you've heard from our TV doctors. Perhaps the predicate for this lawsuit that was filed by Tom DeVore down in Southern Illinois against Pritzker's school mask mandate.
Well, it's just we're coming back to the trust factor. It's over and over and over that the data is used in different ways. There's a lot of fear mongering. As we know, Pritzker said this mask mandate. He said it himself that when he recommended that schools mask and nobody followed, he decided then he had to pass a mandate to make them. He didn't like that people didn't follow his kind of request. But frustrating with all this data is that they're just using the data to scare people. And yeah, I do think legitimately there are more kids, from what I can tell, maybe more kids susceptible to this. But and it's certainly not death, but certainly getting sick. But the way they're using the data to fearmonger, I think, is entirely wrong. And we're seeing that here in Illinois, and we just saw Dr. Ezike do the same thing.
Well, what is the percentage of kids 10 and younger that have COVID? I mean, not have it, but are hospitalized from it? Because a lot of people have it, but they're asymptomatic.
Well, now we're going to go back to one of my biggest complaints is that we just don't have this kind of data. And, they've never provided this kind of detail. Florida used to provide this kind of detail. They stopped about a month ago when things slowed down before this spike. But we don't have the data. So, I just saw a FOIA that I think was done. I'm not sure who did it, but certainly the numbers are up since last month and the month before. But we have to remember that we're really, really low levels of total cases. And, Dr. Ezike came out and said that the number of cases among those that are younger than 10, had tripled from just a little over 5% to 15%. And so I heard that the other day, and my ears perked up, and I said, wow, but what does that mean? And so, we ran the numbers, and sure, in percentage terms, they've tripled, but in actual terms, they're down by half. So it's it's really tricky how they message these things to create fear.
I wanted to get to data in another area, and that's with respect to crime. It's good to refresh this. We've talked about this before, but on the prosecutor's office side, Kim Foxx has dismissed charges against 30% of felony defendants. That was in 2016, in her first 3 years regarding that Tribune study that was looked at. By comparison, Anita Alvarez had dismissed less than 20%. That turns out to be a difference of about 7,000 felony defendants. Now, there's always going to be reasons why, cases, the evidence didn't get pulled together. There's exculpatory evidence and so on and so forth. But just in terms of the volume, it's a significant increase over her predecessor, who, wasn't exactly, Gary Cooper and High Noon either. And so now we see this against the backdrop of the first female police officer in Chicago killed on the job in more than 30 years. Part of the question about Chicago is always the suburban view of Chicago, because without suburban support for Chicago, work and play, the city has a real problem. I mean, you're up on there in the North Shore. I wonder what you're hearing, what you think about this, even when you talk to people that are, left of center.
Yeah, I'm fascinated by that because, as you say, Chicago depends on that whole, big, massive crowd of people taking in Metro, coming into work, coming in to spend money at the restaurants, buying all kinds of things, and it's critical. But when you start combining this crime issue that we're talking about, start adding that to that, the new announcements that they're going to, corporations going to delay their office reopenings. It starts to all add up again, and you got back. Let's not even talk about the public schools and the problems that they create. But I think it's a real issue, especially with the crime. I hear people all the time saying that they don't go down there anymore. I'm hearing from people that live in Chicago, people that are, let's say, well off, who won't walk around right now. They'll take the Uber to wherever they're going. It's got to be a real cause for concern. And again, we're talking about data. We need to really peel the onions on that, and we're going to start doing some of that work because it's really confusing when you hear Fox. I watched a video her team present how much better they're doing at managing the felonies, and now this new report comes out and says the exact opposite of what she says. So where's the truth? And it's really hard to figure out those numbers given that they get to present them.
Yeah, well, clearly she's lying. But I wanted to ask you real quick about the mask mandates. I don't know if you heard, but Meridian School District voted last night for mask optional for the upcoming 2021-22 school year. How do you think Governor Pritzker is going to fight back today when he hears that? That's the school district in Decatur, Illinois, by the way.
Well, I think it's a good question because nobody's quite sure. He's got his emergency order that he's used, and he's using that as his fallback for saying that that's where he gets his power to call for this mask mandate and to enforce it. Now the question is, how's he going to enforce it? Is he really going to withhold monies from school districts because of that? Because that's what he says his ultimate power is, that they can, change the status of the school and then withhold money. And that's a pretty big deal. And if enough school districts do that, he's going to have a problem. The question is how many will have the oomph to push back against this. We have to wait and see.
Well, we're seeing it in Florida in the other direction, and DeSantis
true.
is suggesting the same. And so this is my point, especially for private schools here that are not reliant on state funding.
Don't do it.
Why are you complying? Why not follow Rand Paul's advice on the advice of other doctors like Marty Macri at Johns Hopkins and resist?
Well, yeah, I think there's a couple arguments for that. One, private schools, what the hell? What monies can he withhold? Because the private schools don't get money from the state. I think the other issue is, you got to look at this at the district by district level too. Some school districts, will have their teachers highly vaccinated. Others will have a community that's very vaccinated, and yet others will have very strong mitigation efforts. And so when you add those three things up, knowing from everything we've seen is that the virus does not transmit in school settings. I think they can have a lot of comfort in having mask optional. Other school districts may say, hey, on their own, they may say, hey, we don't have enough vaccinated people in this area, or our teachers aren't vaccinated. Maybe they'll have a stronger mandate or some kind of different mandate. But I think it's really a local issue and a parent issue as to what people want to do. And I think this far along into the COVID, and given the numbers we know and how high we're vaccinated, it's time for a little bit of normalcy. Let's call it that. And normalcy means local control. Certainly doesn't mean dictate from the top.
Ted Dabrowski, President, Wirepoints.org, all things Illinois policy and somewhat and some politics too involved. Ted, thanks for joining us. Please help carry Larry Elder across the finish line out there in California.
All right, you guys have a great day.
All right, thanks. And he joined us on our turnkey.pro answer line.
Listen to Dan and Amy on your smartphone. Download the AM560 mobile app today at 560theanswer.com/mobile.
Do you suffer from peripheral neuropathy in your hands or feet? One drug after the other, continual numbness and tingling, burning pain, balance problems, and decreased quality of life? Are you slowly losing your independence? Hi, I'm Dr. Paul Fisher and lead clinician of Gold Coast Chiropractic. There is now a non-invasive, natural solution for your neuropathy right here in Chicago that addresses the cause and doesn't just cover up the symptoms. Are you experimenting with dangerous drugs such as Lyrica, gabapentin, Neurontin, or Cymbalta with limited success and have been told you have to live with it? You are invited to a complimentary web consultation to see if you can get help.